Veterinary Eye Talk, let's go!
All right, good morning everyone in Australia, and I guess good midday, afternoon, I'm not sure, depending on where in the States or wherever else you are. I'm joined with Dr. Ben Reynolds today. You can see we're both in a slightly different setting, so we're both actually at work. Ben's there on a Sunday, which is very un-ophthalmologist-like, and I'm here at 6 a.m., which is also not something typical of an ophthalmologist. How are you going, mate? How was your week and your weekend?
Yeah, doing well, mate. Glaucoma never sleeps, so neither do I. So here on a Sunday, plugging away. But no, week's been good. Weekend's been nice. Uncharacteristically cold in Las Vegas at the moment, so all the mountains surrounding us snow-capped, which is beautiful, and a bit unusual, different for, different for what I'm used to seeing. But no complaints on my end, my friend. What about you? Anything fun happening?
Yeah, not a lot now, but I was just in Adelaide, for those familiar with Australia, for a wedding, which was good. Ben's familiar with the couple, the Dowd Irving marriage, and as you can imagine, there was a fair bit of alcohol going, so I'm still recovering. Maybe don't book in with me for a week or two from Sydney. No, it wasn't quite that bad. But no, it was a great weekend. I love
Shame
Adelaide.
I missed it. Shame I would have loved to have been there, but yeah, I'm sure it was beautiful, and yeah, that's awesome. That's awesome.
Now, today we're actually talking about, I guess, a pretty simple one, but an important one. Well, simple depending on sort of what level you take it to, but we're talking about vision assessment in animals, and I guess the predominant focus will be on dogs and cats, but we'll also touch on some of our other species. And I think the goal was to keep this sort of, I guess, higher order, not, that we won't go into the weeds of, all the crazy stuff you can do in a research lab. Well, I guess we'll touch on a bit of it. But the main thing was, what's a good toolkit, depending on the species you're seeing, for, vision assessment in a clinical setting. And I guess important to also touch on, with that in mind, some of the limitations. And so I guess to fire us off, why don't we start? Ben, do you want to run us through really briefly, I guess, just how vision works? Don't muck this one up, because it'll that'd be really embarrassing. That's why I've given it to you.
Yeah, perfect. Yeah, it's an important one to get right. Essentially, like the eyes, just the beginning of the visual process. So the eyes are really highly refined tool that's whole job's to capture light and deliver light in a sensible way that the retina can interpret the light. So starting at the tear film, even light refracts as it enters the eye, passes through the aqueous, the lens, and refracts it again, where a little bit of the lens refracts it again, then it enters the vitreous, where a little bit of refraction occurs, but not much, and then is delivered onto the retina. And it's delivered in a really specific way that the retina can get that light, create an electrical signal, transmitted via the optic nerve to the brain. And the brain has multiple layers to basically process that information and create this painting in real time that's updated, many, many times a second. And that's essentially how vision works. So everything in that process has to be working.
Yeah, great summary. So I guess what I'm hearing from a clinical perspective is, and we'll get, I guess, more into this, but when vision isn't potentially working as well, or not working at all, there are multiple points, I guess, within the eye, connected to the eye and the brain. So being the optic nerve, which, as we know, is an extension, the eye is an extension of the brain, or the brain's an extension of the eye, depending on who you ask. And that cable, I always tell clients, sort of like a cable, needs to be functioning, and then the brain itself, also needs to be functioning. So things can go wrong, I guess, anywhere along that pathway. Now, I guess, what tools do we have in clinic? We'll divide this into two. We'll say, what tools do we have in a clinical setting to assess vision? And then in a more researchy sort of setting, what tools do we have to assess vision? So why don't we fire away, and we'll start with, what you use on a day-to-day basis to assess vision. And then we'll talk about, I guess, the more sort of unique things that perhaps people might be exposed to, but probably won't, depending on where they work or yeah, what institution they're at.
Yeah. And yeah, I'd be super curious to hear if we differ with any of these two. Paul, be very interesting to hear. But I guess starting with dogs, who are the most common species we see, the most crude assessment of vision that I think everyone's familiar with and everyone does routinely is a menace response. So doing a really, it's a fine balance where you want your stimulus that you're eliciting when you wave your hand towards the dog to be offensive enough that they give you an indication they can see it. But if you come too violently towards them or you wave your hand too abruptly towards them and you generate some wind, then you can get false positive readings. I guess it's sort of always touched on like a veterinary school. That's sort of like the main assessment of vision. And I guess it's important to note just how crude it is. So when we talk about vision in humans, like commonly we use like the like 20/20 vision, like the which we use the Snellen test to determine, which is where you see those little images or the little letters, and you can say confidently which they are. For 20/20 vision, like that statement, essentially that means that at 20 feet, your vision is what a perfect vision's is seeing at 20 feet, and so. Just for argument's sake, if you had 2100 vision, then you'd be seeing at 20 feet what someone with perfect vision seeing at 100 feet. So your visual acuity is 5 times worse. We know that the positive menace response in a dog, although it's the most commonly used, we get a positive response that I think, and correct me, Paul, but from remembering from board study, it's 20 to 20,000 vision. So, if you're getting a positive response, this dog might have vision 1,000 times worse than a perfectly sighted dog.
Yeah, that's my recollection of it as well. I believe the 20,000 is bang on the number. It's the number I remember. And yeah, it just highlights, I guess, how crude that test is. And it makes sense, right? I mean, it is a very crude test. If all you had was a menace response as a human being, I'm quite confident you'd still be classified as legally, at the very least, legally visually impaired. And so, that does highlight a major limitation we have in dogs. And so people might come in and say that their dog is from a clinical standpoint, they might say their dog's not seeing very well. And you could menace them and find that response is positive, and that's certainly something that I've experienced, particularly with changes to the ocular media, so cataracts that maybe and we'll talk about cataracts in another episode, but cataracts that are not complete, so not mature. But still impeding vision in some way, severe corneal disease. And yeah, Ben's 100% right. And yeah, so I think that's an important thing to keep in mind. There are some other limitations depending on species with the menace response. And so I would highlight, there was a study that came out in cats being interesting and different. And correct me if I'm wrong, but actually,
as always,
yeah, yeah. Depending on which way you came at them with the menace response was important. And funnily enough, I'm quite sure that coming from behind was actually the most effective way to elicit a consistent menace in a cat. I don't even begin to understand why that's the case, but cats. And then I guess there are some exotic species, and I'll let Ben take this away because he's much more of the author to the chapter on monotreme ophthalmology and marsupial ophthalmology. Mate,
that's
echidnas, do they menace? Do echidnas menace much or?
Oh geez, I mean, yeah. In my vast experience of hundreds and hundreds, probably 5 echidnas. Yeah, like to your point, like menace responses in a lot of exotic species are really difficult in that, the term playing possum is not just restricted to possums. There's lots of species that, when threatened, assume all sorts of behavioral traits where they choose to freeze rather than to show a gesture where they're anticipating impact, or lots of exotic or wild species. If they feel threatened, they're not going to elicit a menace response. They're going to exhibit aggression, or a defensive response as well. So I guess like the other caveat is, I guess for some reason when talking about exotics, my mind automatically jumps to like reptiles and stuff. You want to be sure that the species you're doing this on actually have eyelids. So snakes famously have spectacles instead of eyelids. So they don't blink, but instead they have this modified scale across their eye at all times. And so, yeah, you could menace a python all day if you'd like, but you might be disappointed to see that it's unable to menace, not for any reason other than its lack of ability to close its eye.
Probably important not to menace the rattlesnake as well, actually.
Yeah.
You get a negative response and well, you might get a positive response, but not the response you want. If it hits you, it's probably something's worth.
Pretty well sighted if it gets you first try. Second try, we can be a little bit concerned about its vision. Yeah.
So what do we lean on in those species? I mean, I think clinically, when I see a rabbit or a possum, I'm heavily going off the care or the owner's sort of assessment of how things are going at home. And then I'm going more off of our ocular reflexes. So things like the dazzle reflex, so shining a light into the eye, and seeing if, that elicits a blink. Again, challenging in the python. Not that I actually can't think of a python I've seen clinically.
I've only seen a handful, like 2 to 3 or something, but mostly in North America, actually, like be that for externships or whatnot. But
yeah, right. What type of snake?
Oh, mate! So I saw part of my externship was at UC Davis, and someone brought in like a Peruvian sand boa or something ridiculous. Yeah, something that as a 12-year-old, I'm sure I googled and thought looks pretty cool. I don't know. Maybe there's no such thing as a Peruvian sand boa. It wasn't a red-tailed boa because it's one of the few species I do know. But yeah, it was some cool-looking thing that had a subspectacular abscess. I'd have to look up the snake and feed it into AI to tell me what species it was, probably. But
that's pretty cool.
That's pretty
cool. For those who don't, so Ben and I both were pretty into reptiles when we were younger. Don't know whether I want to admit that, but anyway.
Paul was more into it than me. He was breeding them. I had dreams of breeding them, but Paul was doing the thing.
Yeah, that was the scheme my parents were not familiar with, and till too late, and that was their mistake for buying me a male and a female of the same species. But anyway, for Australians, I mean, we can only keep Australian species of reptiles. So when we go to these, this is something I really want to do. Because every time I've gone to the States, I've always gone into the pet shop and seen all of the cool animals there.
Mate, like completely as an aside, my mum was in town and I had the same thing where I was like, I always want to do this. And it was like my first 2 or 3 months living here, and I drove past the place and we had some time to kill. I can't remember what I was doing, but I was like, do you mind if we go in? I'd just love to see what they've got at like this random small pet shop, the size of a petrol station. Mate, they had a Nile monitor, like this like meter long thing, Nile as in like from the Nile River, like, this like North African giant lizard sitting in this tiny cage, which is like, probably not the ideal living situation, but incredible that you can just rock up and for like $200 or $300 you can buy this like dinosaur basically. Yeah, it's very different to what we're used to. Very different.
Yeah. No, we don't have that. Ooh. Not legally, anyway, in Australia. I'm sure there's someone out there with a Nile monitor. He's sweating at the moment.
Yeah.
So exotics are one thing. I guess
we should probably touch more on cats. You mentioned the menacing cats, which I think is great. I guess because cats, everything with them is difficult, and we were both trained at the same institution, Eye Clinic for Animals in Sydney, wonderful place. But one of our mentors, Jeff Smith, in particular, had a pretty novel and pretty effective way to assess vision status in cats, Paul, which I know Yeah, it's a great one to tell. So I'll hand it off to you. It's a good one.
Yeah. Look, I would preface this by saying, the first time I saw Jeff do it, he didn't particularly explain to me or the owner what he was doing, and I think that is a critical step with this. I think you should inform them, because what he would do is he'd basically put the cat on a chair, or a stool of some description, and then we'd all stand around and assess whether or not the cat would actually try and be able to and successfully get off, because and then he said to me, he's like, mate, cats, they don't want to sit on a chair in a console. And I mean, to be fair to him, I've seen very few cats who want to stay put. But the first time I saw him do it, he didn't announce what he was doing to anyone, and he just took this cat and put it on a chair in the side of the room, and then stood there in silence and stared at it. And we all sort of stared with him, not really knowing what we were looking at. But indeed, what you find is if they're not visual or they're vision impaired, they'll sort of reach, is my experience, to see they'll touch around them, and they won't confidently jump off. And actually, I believe that after we all laughed at Jeff about this for several months, maybe years, a paper did come out, and I think they found that his method was the most accurate method.
Absolutely. And yeah, like the description you made, I think is really good. They're like pour into what the vision impaired cats will pour into, like the nether, and you can see them like reaching, and they're like, man, I don't know how far down this gap is, so they go searching for it, which when you see it, it's pretty striking, and you're like, wow, like, yeah, it's really effective.
Now, a few caveats, a few, I guess, criteria. Don't do it outside. Car park's a bad spot to do that one, in case they're visual. Maybe close the door. Maybe with big cats, don't put the lion on a chair. For those in North America, I don't know. I mean, but no, it does. It works very, very well. And
yeah, no, I guess if you are to do a line, make sure you got a big chair. Would be
a big chair.
Yeah, you want a big chair. That's for sure. Yeah, only cats, mate. Horses, they also don't like sitting on chairs, but not vision related. Speaking of horses, maybe we should touch on them. So as like a prey species, they're very happy to menace. So we spoke about cats being a little bit difficult to elicit a menace response. Horses, very flighty creatures, prey species. So they give you a very convincing menace. Again, a great adage from Dr. Smith. When you menace them, sometimes if they're very startled, you can even hear them blink. You like literally hear like this like noise of their eyelids clapping together, which is pretty impressive. Things that you can definitely do in other species, but in horses is a lot more practical, is stuff like maze testing as well, where you can set up some light obstacles that are not going to hurt the horse or startle the horse, or make everyone freak out if a blind horse bumps into it. But yeah, typically like bins with hay bales in them so that they don't fall over with the breeze that comes past and startles your horse. We do that if I'm like borderline on a case. Like I do that occasionally with dogs if I'm having a really difficult time to assess vision. It's not something that I do routinely. Certainly papers have described, having random mazes that you can vary, and you can time dogs, and then you can have like a standardized time for all your visual dogs, so that when you have an impaired dog, you can have a new standardized time. I've never done anything like that, but that's a pretty useful tool, I guess, theoretically. Well, how often do you maze test patients, Paul? It's something you do routinely?
Oh, not routinely. Occasionally, and mine is very crude. I set up like I put a towel down on the floor in the consult room and ask the owner to stand on one side and usually face the dog the wrong way in the corner, and then sort of let him go, and we'll all stand there and see. And sometimes the dog will walk to the owner, sometimes it'll walk over to the nurse that's been giving it treats, or sometimes it'll bump into things. I have done some maze testing, actually. There was one case that I did where I ended up having to, I had cataract surgery in one eye, and it was still menacing in that eye. But the owner was very confident that vision was not good, and I was getting an inconsistent menace, and it had a very opaque ocular media in the vitreous, and what did sort of appear to be, but was difficult to make the call on whether or not there was a low-lying sort of retinal detachment. And so I blindfolded the eye. This is going to sound really sophisticated, but I used some vet wrap and a gauze swab and blindfolded the visual eye, and Maze tested this dog with the operated eye, and indeed it was, there was no vision. So it can be very, very useful.
Yeah, and to your point, I had a beautiful little boxer puppy with congenital cataracts that I did cataract surgery on. It had posterior lenticonus and patent hyaloid vessels, and also was microphakic and microphthalmic. So basically, took the lens out, and then I was eyeballing the size of the lens capsule, and the ultrasound was telling me it was going to be close to put a 12 in it, a 12 millimeter intraocular lens. I should elaborate. But yeah, looking at the misshapen lens capsules, and the tiny eye, there was no way. So basically, I left the eye, both eyes aphakic, and the owner was telling me, look, vision's definitely improved from prior to surgery, but I don't know, vision's not perfect. It's good and it's better, but it's not perfect. And I guess I was having a hard time getting information from the owner about, does that mean the dog's at risk of falling downstairs, or does that mean the dog's, if you throw a ball for it, it'll only catch it 9 out of 10 times? Where are we on that scale of poorly sighted? So I set up a maze full of, chairs, and I moved tables and all sorts of stuff. And this dog was incredible, just darted through 6 different objects, and then, found the treat. I'm like, all right, this is just, you always have to take owners with caution, because I was looking at the eyes bewildered, this dog should have pretty good vision. I don't really understand why. So yeah, I guess although I also use the owner's assessment as a very useful tool of vision, I guess you sort of have to take it with a bit of a grain of salt sometimes, and read the room of owner expectation of what, they think their dog should be a hyper athlete that catches the ball 100 times out of 100, but sometimes it's not the vision, sometimes it's the dog.
Now on that, it's a good point, because we do get the odd agility dog and everything coming in, and they might say that, that their dog is, not seeing as well as they'd like, but you do a full assessment and you don't see any issues, and that all of the light reflexes are normal, menace is normal, the ocular examination is completely normal, and then you have to try and sort of come up with a reason potentially for this owner why the dog might be performing poorly. And there are some tests you can do, I guess, that looks into another sort of aspect of vision, and something that I guess as humans we're more familiar with, and that is, basically refracting the dog to see if it has any issues with being either short or long-sighted. Now, I remember I went on a course from work. I went overseas, and I did there was about a 3-hour lab on refracting dogs. And I did that, and I came back, and suddenly I was Sydney's leading expert in canine refraction. And so I was getting asked to refract dogs left, right, and center at our clinic for about a month, and then it sort of died off. But is that something you do in your practice, Ben? Do you refract dogs very, very often? Or?
I guess keeping in mind it's a differential, and there are some breeds that more commonly get refractive errors and stuff, but truthfully, no. I can't tell you the last time I've done retinoscopy or skioscopy. But yeah, no, nice differential to have when nothing else makes sense. I guess, yeah, for me, it's sort of a differential for, subtle vision changes, but the dog is still visual, just, possibly growls at the owners, and then at a certain distance realizes the owners are its owners, and then suddenly it's like, there's some like inexplicable behaviors that, sometimes I'm not sure if we need a veterinary ophthalmologist or a veterinary psychologist to get to the bottom of what's going on with these guys. But yeah, for sure. Like, it's not something I test, but I haven't done so in years, but it's definitely a possibility, I guess, to keep in mind.
Yeah, I'm sort of in the same. I'm in the same same boat. I know, based on the course that I attended, that there are some people who really, do it a lot as part of their practice. Would love to hear from you if that's the case and your experiences with that, because I'm, like Ben, I'm always open to learning and developing new skills, and I guess reigniting them. But I think, we're all. I just don't think I get I just don't think it crosses my mind that much, and I don't get many cases where I feel
it's probably twice a year that I would think it's valid, and even then, often the owners aren't motivated enough. Like, they'll come in for something else. The eye's red, for example, and then you ask, like, "Oh, and have there ever been any eye issues?" "Oh, so he's just always a bit weird. Like, his vision's not perfect. Like, he'll do some strange behavior that may be a primary behavioral issue." Like, in my experience, very rarely is it the primary issue that people present with.
Yeah, I agree. I think the only exception to that I've seen is, agility dogs or something, and their poor performance. And I have to admit, I always think back to when I was at vet school. We had this really great lecturer in equine sports performance, who I believe is now representing Australia over at the University of Florida. So shout out if you're listening. I'm sure you probably not interested in our ophthalmology podcast, but anyway. And he always used to say the number one cause of poor performance is that your horse just isn't that good.
I'm sure he put it that delicately as well. As
he did, yeah.
Colleagues tend to, they don't like to use other adjectives or anything. So I'm sure it was put that plainly.
But yeah, that was it. He and that was the number one cause of poor performance. If someone came in and said that they weren't winning, the Melbourne Cup, it was more than likely not a joint issue, and more than likely it's just their horse was never going to win the Melbourne Cup. But yeah. All right, before we wrap up,
I might have to wrap up pretty quickly, I'm afraid.
Yeah, okay. Well, why don't we just fire through I guess some, very I guess just briefly some things that are done not so much on the clinic floor, but in research settings, I guess more often. You got a couple there, Ben?
Yeah. So I had to refamiliarize myself with these things because, again, it's not something we do clinically. But yeah, just for everyone's knowledge, like, there's all sorts of stuff described that is ranging from things where you can train dogs to look at different stimuli, and then you can assess from different distances what stimuli seems to alert them to. So there's some standardized tests created recently by not to keep this to an Australian theme, but by Dr. Kathleen Graham, who's a veterinarian who did a PhD in all things eyeballs at University of Sydney, and essentially came up with a nice trained assessment tool, which is very interesting. Not super clinically applicable, but really interesting. And then in addition, also developed a questionnaire for owners that's been validated, and it's highly accurate. So a series of 17 questions where owners' responses, I guess, can try and quantify, I guess, their dog's vision, which is pretty cool.
Yeah, I think those are the main two that I'm familiar with. The other one that I just searched up before was looking at optokinetic responses, an assessment of visual acuity in the Python, which
there you go. We're getting a lot of airtime this podcast, our slippery friends.
Yeah, I've got to be honest, it's not something I do that routinely. Maybe once a week or something.
Yeah, once or twice. Yeah.
All right, so quickly summarize, I guess, the tools we use clinically are generally the tools you learn at vet school, which is great. Menace response, a good ocular examination, our ocular reflexes, I think predominantly, you know, the dazzle, and
when
then
a maze test is useful, using the owner's history and story taking as a tool, not as the whole assessment of vision. And I guess ultimately putting this together, like we're sort of using all this information and painting a picture, right? It's not that one test trumps another. It's often we're using multiple snippets of information and trying to create an educated assessment.
I think that's a really good summary. So we'll end there. Thanks for joining, everyone, and thank you, Ben, for being here on a Sunday.
Oh, mate, thanks for coming at the crack of dawn. So appreciate it.
All right. Thanks, mate.
Catch you, mate. Bye.